Hi everyone. Today we are going to discuss about how to calculate heart rate from an ECG. So the coming slides you can see that the way of calculating heart rate from an ECG. There are different methods are there to calculate the heart rate. Welcome back to my YouTube channel Ali's EduTech. The first method is 300 rule method. It's called the 300 rule method. What we have to do for this method, first you have to count the number of large boxes between the two R waves. As you all know that we are having large squares and inside the one large square there are small squares also there. So for 300 rule method, between the two R peaks or between the two R waves, you have to count how many large boxes are there. So here you can see between the two R waves, two R peaks, there are four large boxes 1, 2, 3 and 4. The formula for calculating in a 300 rule method is 300 divided by number of large boxes between the two R waves. Here 300 is constant. So in this ECG the heart rate is 300 divided by 4 is the number of large boxes between the two R waves. That is, so the heart rate is 75 beats per minute. The second method is 6 seconds method. It's called a 6 seconds method. For 6 seconds method, this we can calculate in case of the patient is having an irregular heart rhythm. Such cases we can use 6 seconds method. In 6 seconds method, first what you have to do is count what is 6 seconds, how you can get a 6 seconds method ECG. 6-second ECG means the ECG in a 30 large square. In the strip, the 30 large square is 6 seconds. So what you have to do in this large box of 30, how many R waves are there? R peaks, how many are there in a 30 large squares? Count that. That number multiply by 10. So here you can see if you count there are 30 large boxes. Between that there are 4 R peaks are here. 1, 2, 3 and 4. Multiply with what? 10. 10 is constant. So 10 multiplied by 4. Here the heart rate is 40. As you can see that it is bradycardia here. Because heart rate is less than 60. The third method over here is small square method. In small square method, what you have to do is, as I discussed, one large square contains small squares also. So what you have to do is, between the two R peaks, how many small squares are there? One large square is 5, and how many large square first you should see. Here you can see 4 large square. So one large square is 5. So 5 multiplied by 5 multiplied by 3 is 50. So 1500 is a constant here divided by 50. Once more I'll explain. What you have to do is, here you have to count the small squares. So one large square contains 5 small squares. So how many large squares are here? Here you can see 1, 2, 3 large squares. So one large square, count the number how many? 1, 2, 3, 4, 5. 5 small squares. So 5 plus 5 plus 5 because 3 large squares. One large square is 5 small squares. So 50. So the formula for calculating in a small square method is 1500 divided by the number of small squares between the two R peaks. Suppose here if it is 5, it will be 20 small squares. So these are the three methods of calculating heart rate in an ECG. So before you calculating the ECG, make sure that these are the tips for accuracy. Verify the ECG calibration. Always a calibration standard for the paper should be 25 millimeter per second. Check the artifact. Remove any noise is there. baseline wander, or any other artifact that could interfere with the peak detection. Many artifact, maybe the ECG lead is not in proper position, so artifact can be occurred. So that all you should make sure that these all should be avoided. These are the tips for the accuracy. Thanks for watching Alice EduTech.